Lova from Sweden, okay, and they've just finished their 2x2 week scoliosis specific exercise course. We've got Pia, who is a paediatric consultant, and Lova, who is a 14-year-old teenager who, when were you diagnosed with scoliosis?
2016.
2016, so a few years ago.
Yeah.
And what was the sort of process leading up to coming to the clinic here?
I had a really big angle.
Okay, you had a big angle.
And then it was on the limit to surgery, so we were trying to avoid it, so then we came here.
Okay, can you remember the size of the curve, the cob angle measure?
42.
42, okay. So you were a candidate for surgery,
Yeah.
but that wasn't something that you wanted to
No.
do. And was there any therapy or exercise or any other sort of course of treatment that you knew of?
I have a brace during night time, 8 hours every night.
8 hours, okay. And that's the overcorrected brace, the Provenance brace,
Yeah.
isn't it? Okay. And when did you start wearing that?
In May 2016, I think.
Okay. And after you started wearing the brace and started the exercises here, did they do another X-ray of your back?
Yes, they did.
And what was the result from that?
The angle has been smaller,
Okay.
so now it's only 37 or 38.
Excellent. Good. Okay. Super. And then Pia, you initially came to us with a lot of pain.
Yeah, lower back pain.
Lower back pain. And sort of when were you initially diagnosed with scoliosis?
Same age as Lova, when I was 12, and I wore a Boston brace for 3.5 years.
Okay.
Yeah.
And you also have a family link. Your sister also has.
Yeah, my sister and my grandma.
And your grandma as well. So there is often a genetic link with scoliosis.
Yeah.
Okay. And sort of through your pathway, have you had any other treatment apart from the Boston brace?
Well, I've tried several physiotherapy in Sweden, but not this intense.
Okay.
Yeah.
Excellent.
And they don't have this type of treatment at home.
Excellent. What do you feel you have learned or can take away from your experience?
We are both much stronger in our backs and our core, and we got a lot of knowledge, I think, and awareness about posture and how to think.
Okay.
Yeah.
Good. Excellent. And do you feel there is any differences between sort of a child or a teenager coming to the clinic and maybe sort of adult like yourself?
Yes. For Lova, it was to avoid surgery, and she will not have surgery now, so that's good. For me, it was to reduce pain, and it's better. It's not gone, but it's better. And I think you should have a reasonable expectations when coming here. So you can't change your back when you're fully grown like me, but you can get stronger, you can reduce pain and get the awareness.
Good, excellent. Super. Anything else you'd like to touch on?
We think it's very good here.
You do?
All the physiotherapists are good, with a lot of knowledge about scoliosis and how to treat. There are many physiotherapists in the room every day, and you always get some extra if you want to. Yeah.
We have quite a few patients from Sweden.
Yeah.
Did you have a recommendation?
Yeah, it was one of my colleagues in Stockholm who recommended your clinic.
Okay, excellent. Well, thank you very much. I hope you've enjoyed your time at our clinic, and we also look forward to seeing you